Okay, outstanding dentistry, just cross that out. There's no way to know your outstanding dentistry unless you have a deep chart audit. This is another one. Like you said, you could print those reports. You could print a report of all the dentistry that's been treatment planned and not done. They're usually not accurate for many, many, many reasons. I will say, though, what is outstanding dentistry relevant to? You hear me use the term cabinet millionaire. So the average practice in this country with 1,800 patients has minimum $400,000 to $500,000 sitting in their charts, just waiting to be identified, engaged, and checked in with the patient if they're ready to go ahead. So that's not probably something you'll track on a regular basis. I just didn't want to leave it out for you to say, where is it? Okay, so it'd be incomplete. Now, your procedure mix. This is a historical run of your procedure by category. And category is every fee fits into a category of the number that they begin with, right? Your codes do. So this is, I've never seen a computer system not be able to do this. But get a history of where you are. It shows you what is the treatment in the last 12 months that we've delivered. What's our historical type? You know, some practices there's no, especially when you're looking at the last year, 2 years, you know, you can look, oh, this practice doesn't do implants, or you're doing a lot of drill and fill basic. I want to give you an asterisk on this. Single unit crowns are buried in the restorative category. Okay, and single unit crowns are much different when we talk about goal setting and we talk about planning and engineering your schedule, which we'll talk about how to set your schedule up, not just fill white space, because that's how you meet your goals. The individual crowns are buried in the basic restorative, so it's a little bit of a confusion. If you pull those out, that'll tell you how many units you've done of single unit crown and bridge. Okay, that makes sense? And then you basically break it down into each provider. These are all the metrics that deal with each provider. So you've got a doctor, what's their gross production, how many treatment rooms do they use to do it, how many total patient visits. That's easy to find in your computer. You have the team track at the end of the day. I saw this many humans. You know, in hygiene, I'd say I saw 8 people, 4 were health, 2 were disease, and 2 were maintenance. In restorative, we saw a total of 12 people. Your volume, the biggest jump in growth a dental practice restoratively takes is when they go from tooth dentistry to quadrant dentistry. And what do I mean by that? I don't mean you invent things to do, and because you're prepping one tooth, you just do the one beside it for fun. That would be litigation. Okay? Go ahead.
Sorry, I missed the first session. What's the difference between health and maintenance in terms of hygiene?
Great question. Okay, so let's go back and then remind me where I'm at right now, okay, because I'll forget. So health is completely healthy, pink, firm tissues. There's no measurements greater than 3. They've got their home care in check, and they've got a sound foundation to their dentition. Maintenance is they've had a past loss of bone that cannot grow back, and they need to not be called healthy again. Okay, so let me give you an example. If I went to the doctor tomorrow and she said, you've got adult onset diabetes, okay, which has no, diabetes has no cure. Does that mean I can't live happily ever after to the age of 100 like I'm going to live to and have a great life? No, it just means I need to do different things to be able to have that. So an example, you see what I'm saying? Because we use with the patient, we use the simplicity of once you've lost 50% of the bone that holds your teeth in your mouth, it's not like there's something we can put in there for it to all grow back up to the center, all grow back up in attachment. So a big confusion is a patient comes in, they have moderate perio, you treat them, you reevaluate them, and they don't go back into health. What's the only infection state in dentistry that can go back to health? Gingivitis, because it's a soft tissue infection. And you've got all kinds. You've got 25 different types of gingivitis, pregnancy, and medication induced, right? There's all kinds of gingivitis. So does that help you answer it? It's when you have an evidence of loss of the foundation in your measurements and your radiograph confirmation. We would just never call them health again. It doesn't mean we beat them up for the rest of their life going, you're never going to be healthy. It's a bad time, right? That's not going to make them feel better, but you just say you're in a maintenance state. And what's often the intervals we use with maintenance patients? 3 and 4 months, and that's often because there's areas they can't access no matter what we teach them to do at home, that they need our professional intervention to disrupt the bacteria that collects over time. Okay? So we'll talk a lot about how you can work. Yeah.
So how about the healthy one? Once a year is enough?
6 months for a healthy practice and to be safe, because remember, dentistry is prevention rather than repair now. It's not like 30 years ago it was we're working to repair everything and waiting till it broke down. It's prevention, and I tell patients this, our commitment is prevention rather than repair. It's to prevent unnecessary pain and suffering. So your 2 hours a year that you commit to your visit with your dental hygienist is going to keep you in prevention mode, so nothing gets away from us. Now, they're going to come in and tell you, my insurance changed to 9 months. Why do insurance companies do that? It's not because they have some new research that bacteria can sit on your teeth for not. Yeah, they're doing it because they're reducing the benefits based on a negotiation with the human resource person at the place where the person works, right? So when you look at it, if someone has, someone says, well, my insurance only pays for me to come every 9 months, I say, great, it'll support you, right? Great, good news. It will support and provide benefits for every other visit. So how can we schedule? A lot of people with, a lot of practices, what they do with 9-month patients is they take how many visits they're going to need in a year and really just show them, you know what? Great news is your dental benefits are going to pay for this visit. Let's get you in the frequency that's best for your health, and let's work with you to find a way to fit it into your budget. Okay, we're going to talk a lot about insurance. A lot about overcoming insurance. If we just do what the insurance says, it's not going to get any better. And when people lose their insurance, they tend to do the behavior that you've trained them when they had dental insurance, and then it's going to be an interesting time, because what percentage of the spending in this country is supplied by employer-supplied insurance? Remember? I don't quiz you to see if you're awake. I'm preparing you for an examination coming up in December, just saying.
500 to 2,000 per year.
Keep going. What do you mean?
One patient spend per year, right? 500 to 1,000 on the
Well, you're talking about something different. I will tell you in Ontario, okay, I can't say it nationally because Alberta skews everything, but in Ontario, your average spend per patient is $375 per year. Now remember, average is what? They take everyone, right? Okay, if you think about it, you look at 2 hygiene visits a year, that doesn't seem like a lot, right? But they're taking it. 50% of patients with dental insurance only spend $500 of their maximum. Okay, but 50% of the 13 billion, it's actually 51. 51% of the spending in this country is provided by employer-supplied insurance. So there are, out of this, in the 16 practices in this country, there's probably, it's hard to tell because they keep dentists in the register 10 years after death and postulate or something to keep them in there. So if you're using that, but there's probably, 14,000 doors in this country with 60% of them in Ontario. Okay, of practices, of all the patients who have dental benefits, they only spend up to $500, and we're spending all this time on being dictated by insurance. Someone soon is going to come up with a way in September to be able to go into your system and look at all the unused insurance somewhere. It's close. Remaining insurance is a big way to make your quarter four a big deal. And you know what? It's interesting. You get a big aha when a patient, and you might have had this come. You might have had this come up. A patient comes in right. They said, "I'm going to retire." And you know all those teeth you told me about, and all those predeterminations for the last 10 years. Okay, do it all, and use all that money that I didn't use. You'd be amazed how many of them don't realize it ends. And you know something? They pay for it. It's taken out of their paycheck, right? So when you look at, it's not about being dictated by insurance. It's about, are we maximizing the benefits that they do have? Because the research shows we're not. It shows they're not. And if they were, I don't think we'd have as much insurance, right? So insurance companies love it. And the more limitations they make, right? What's the most overused exam? Specific. They're on a hunt.